Chances are most times you're scrolling on your phone or watching TV, you see the ads. Weight loss drugs are marketed as a game changer to help drop pounds. But 11Alive News Investigates found a surprising number of people are getting their GLP-1 doses wrong, and that is leading to a surge in calls to Georgia Poison Center. Our experts tell our consumer investigative reporter Liza Lucas that trend is not slowing down. Liza, just how big of a jump are we talking about?
Well, it's a significant one, and it's not just here in Georgia. It's definitely not a hard leap either, Cheryl, to realize the more people that are using these drugs, the more calls and questions are going to come in. The Georgia Poison Center started tracking these call numbers tied to GLP-1s just back in 2023. So this data is relatively new, but that year they had around 129 calls. I want to bring some of that data up for you now. The following year, that nearly doubled. Take a look here, 246 calls in 2024. And as of early this month for September, the center has already surpassed that with 254 calls. And experts say what really stands out when you look at this data is that the majority of these calls relate to some type of dosing error. Here's Gaylord Lopez, Executive Director of the Georgia Poison Center.
When you look at the data, nearly 75% of these calls that involve dosing errors involve people who are doing it on the very first dose. So these are people who maybe didn't get the proper education, who didn't get the right information from the internet health provider, or they were just confused when it came to how to deliver and how to administer these drugs. It has caused our call volume to skyrocket.
This is an interesting side effect here, right? And it's not just Georgia, Cheryl. Poison centers across the U.S. are seeing the bump up in calls as well.
It's interesting the point he made about the internet part of this, because I think in the beginning, those who were getting it were more likely to have the one-on-one with a doctor in person who might have been explaining more or showing the dosing. And now more people are accessing this through the internet. Is that one of the things that could be driving the increase here?
You've got it, Cheryl. Nail on the head right there. That is something he definitely suspects, because when you get the brand name versions, usually you are getting a pre-filled pen, so very easy to give that dose yourself. But what Lopez is seeing when he looks and analyzes these calls are people getting vials and syringes, and then you have to do some math yourself at home, and that's leading to some errors right there. Again, that is leading him to also think, as you mentioned, that people are going to alternate sources such as online. We know that there have been prior shortages, so simple Google, you can find a lot of different ways to get this drug right now. But as Lopez mentioned, sometimes that means you're missing out on critical education when it comes to dosing and what you need to do to take care of yourself.
Such a good point. Not just giving the shots yourself, but filling the syringe can be a difficult thing if you're not used to doing that. You know, that's
Exactly.
what medical professionals usually do.
Right.
So people are feeling enough to reach out to the Poison Center. What kinds of problems are patients experiencing here?
Well, gastric issues, no surprise there. We're talking about nausea, vomiting, abdominal pain, but sometimes also heart rate issues, blood sugar changes. And we also learned when looking at the data with Lopez that around 40% of people are getting referred to the ER after this. So some significant calls here, and this is data that automatically goes into the national system. It's going to be analyzed on a national level as well. So these are important calls, and we want people to call when they have questions.
Sure.
But yeah, they're seeing significant side effects, usually even more acute than what they would normally see when taking the drugs.
That's really telling that many are going from that phone call to an emergency room. So really important information, Liza. Thanks so much.
For sure.
Remember, you can reach your local Poison Center anytime by calling 1-800-222-1222. And you can watch Liza's full report on 11Alive Plus right now, an important one to check out for sure. If you have questions about weight loss drugs, email us at weightlossdrugs@11alive.com. It's a story we will stay on top of for you.